In the war against coronavirus, these are the weapons that doctors and nurses need to go into battle. N95 face masks, gloves, face shields, and other protective equipment that's now in critically short supply. Local, state, and national leaders are desperately trying to find more.
Many more fully loaded cargo planes are right now on the way.
So it may come as a surprise that the government recently auctioned off the very items it's now urgently trying to get a hold of. 13 Investigates has found tens of thousands of PPE, personal protective equipment, needed to fight COVID-19 were auctioned off by federal agencies, even as the pandemic was starting to bear down on the United States. The VA healthcare system in Marion, Indiana, for example, it auctioned over 100 PPE kits. The auction listing includes N95 masks, gloves, gowns, hoods, face shields, and PAPRs, powered air purifying respirators that are desperately needed right now in hospitals. The kits had upcoming expiration dates but were good until this summer. Instead, the Northern Indiana VA healthcare system sold the PPE kits in late January to an anonymous bidder for about $2,000. In Denver, the General Services Administration has been auctioning hundreds of cases of surplus N95 masks. The most recent auctions closed in February. 160 cases, roughly 25,000 protective masks, with winning bids totaling more than $100,000. It's just a tiny fraction of the PPE now needed by frontline medical workers, but it still raises questions about how the government coordinated its response to the pandemic.
It's the old case of, does the right hand know what the left hand is doing when it comes to the federal government?
Scott Amy is general counsel for the Project on Government Oversight, a watchdog group that tracks government waste.
There should be a review about what GSA knew at the time.
The General Services Administration told 13 Investigates after it auctioned 80 cases of masks in late February, it canceled the sale, retained the masks, and sent them to other government agencies that needed them. And it says the 80 cases of N95 masks that it sold in early February took place prior to the declaration of a crisis in the U.S. But all of those auctions took place after CDC staff concluded in January that COVID-19 posed a very serious public health threat.
Was anybody inside of GSA questioning these auctions and asking questions about whether it's a good idea to auction off materials that could even possibly be used in the coronavirus?
The VA Medical Center in Northern Indiana told 13 Investigates it decided to sell a small amount of excess equipment not typically used for COVID-19. When 13 Investigates pointed out that all the items in these kits are used for COVID-19, a spokeswoman then changed the story, saying prior to selling these items that were originally found in the kits, we took out essential COVID-19 PPE. But the auction website tells a different story, indicating essential items were sold, and the VA confirms it did auction off PAPRs, saying those devices are non-essential while treating coronavirus. Don't tell that to nurses and doctors.
You do need the PAPRs, the powered air purifying respirators.
Jean Ross is a registered nurse and co-president of one of the nation's largest nurses unions. She says everything that was listed and auctioned by the Northern Indiana VA system in January is critical safety equipment now needed by healthcare workers.
Those are the kinds of things we've been asking for and begging for.
GSA tells me it is no longer auctioning any items that are needed by healthcare staff here on its website. The GSA also says that the N95 masks that it had in stock have all been transferred over to the CDC and the Department of Homeland Security. If you want to see more of the agency's response, you can read that now at WTHR.com.